Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Chief Medical Officer and Founder of Atlantic Coast Aesthetics, Dr. Thomas Pane. Dr. Pane, we have the Question of the Week segment here, and this question comes from, it looks like Hollywood, Florida. They've recently had a tummy tuck, and they're saying that after they had it, there's still some loose skin, and just wondering if they should have a revision, or what do you think? You've seen the pictures. What's your best recommendation here?
Yeah, in this case, the person, it's been several months after surgery and they still got some loose skin. Now, in some of the pictures, there's a lot of skin laxity. It's not hanging. When they're standing straight, there's actually a nice shape. But when they pull on their skin, they're seeing a lot of looseness. And I see some stretch marks, and I'm questioning whether this person had massive weight loss. Did they lose through diet or exercise or maybe bariatric surgery large amount of weight, like 70, 100 pounds, more than that? And what did they look like before the initial surgery? Those are the things we don't know. So what we're left with is somebody that has a decent shape when they're standing, but there is some laxity of the skin. And again, it's not hanging. In this case, it's tricky because you could certainly take out, anytime you got loose skin, you want to trade it for either a longer scar or a different scar. That's certainly possible. The question is whether or not that extra scarring is going to do what this person wants. Because remember, when you take skin out from a tummy tuck, you're not making the skin tighter. You can't go back in time and make the skin tighter like it was before the weight was gained and lost. What you can do is remove it and then trade it for a scar. Now, in this person's case, they might think about an up and down scar, although I'm not real enthusiastic about that unless I see real laxity coming from the top. But there are people that will accept that procedure and want it, especially if they already have a scar up and down. This person doesn't. Another thing that I'm not crazy about here, because it's another additional scar, as opposed to the lower scar that they have, is sometimes there's something called a reverse tummy tuck where you can pull up the abdomen and that scar goes in under the rib cage. That's a special procedure for certain indications. This person could actually get away with that if they wanted it. But here, I tend to think that they probably were a good candidate for the up and down scar procedure based on how loose the skin is. And if I saw pictures of them before, I might have a better handle on that. But for now, if another procedure is done, I don't think for this person that extending the scar maybe around to the back is going to work a lot, because there's some looseness of the upper part of the skin and on the sides here. And if you have that and it bothers you, you really ought to think about converting to the up and down scar procedure. But again, that now gives you a visible scar that you can't hide. If you don't already have one, that's not for everyone. This person really does need to have an in-person consultation, go over these different options, have a surgeon take a look at it, actually can touch the tissue, and then can kind of go over with them what the pros and cons are of the different procedures. And again, in our practice, I do the full range of these. So I'm not interested in pushing somebody into one procedure or the other. What we do is we tell you what all the different options are, and then what you can get out of each one, and whether you accept the limitations that come with that particular procedure. Sometimes people don't do these up and down scars. They don't go around the back, and they might tell you, well, I can do this and that. And maybe that's correct, maybe that's not correct. But again, you don't want to be in a situation where you're being presented one or two options because that's all that's offered. As long as everything's offered, and most people that do a lot of this kind of work do offer everything. And as long as you're having a consult in that kind of practice, I think that that's the best way to go, to see what your options are and to make a decision that you're going to ultimately be happy with. Because we don't have to live with the scar on the skin. You're going to have to do that. So we want to make sure that it's matching the right procedure to the right person. And then you go from there. So hope that covers it.
Well, thank you, Dr. Payne. And if you have a question, cosmetic surgery, plastic surgery related, please reach out to Dr. Payne via website, Instagram, Facebook, or Twitter. And Dr. Payne, we appreciate your time, and we'll see you on the next question.
Great.